Hi students, welcome back to Learn with Professor Janula. In this video, we are going to discuss the danger signs of pregnancy. If you find this video useful, don't forget to like, share, and subscribe to our channel, and support us for more educational content. Now, let's get started. Pregnancy is normal, but can have complications. Danger signs are warning symptoms that aid early detection. Awareness and quick action reduce risks for mother and baby. Education on these signs is vital for safe motherhood. One of the important danger signs during pregnancy is vaginal bleeding. Remember, any bleeding in pregnancy, whether in the early, middle, or late months, is considered abnormal. It can be a warning sign of serious conditions such as a threatened abortion, placenta previa, or abruptio placenta. In some cases, it may also indicate other complications that require urgent medical attention. So, whenever bleeding occurs during pregnancy, it should never be ignored. Immediate consultation with a healthcare provider is essential to ensure the safety of both the mother and the baby. Another important danger sign in pregnancy is severe abdominal pain. This is always considered a red flag because it can signal life-threatening complications. Severe pain may be due to conditions such as an ectopic pregnancy, placental abruption, uterine rupture, or other serious causes. That's why, whenever a pregnant woman experiences intense or persistent abdominal pain, it should never be ignored. Immediate medical attention is necessary to protect both mother and baby. During early pregnancy, some amount of nausea and vomiting, commonly called morning sickness, is quite normal. However, when vomiting becomes severe or persistent, it can be dangerous. This condition is known as hyperemesis gravidarum. It can lead to dehydration, electrolyte imbalance, and poor nutrition, which can affect both the mother and the developing baby. So if vomiting is excessive and does not improve, medical care should be sought without delay. Another serious danger sign during pregnancy is the presence of severe headache, blurred vision, or convulsions. These are neurological warning signs, and they are highly suggestive of preeclampsia, which is pregnancy-induced hypertension with protein in the urine, or eclampsia, when seizures occur. Both of these conditions are extremely dangerous, as they can cause stroke, placental abruption, and restricted growth of the baby. That's why, if a pregnant woman experiences a sudden severe headache, vision problems, or fits, she should be taken to a healthcare facility immediately. Another serious danger sign during pregnancy is the presence of severe headache, blurred vision, or convulsions. These are neurological warning signs, and they are highly suggestive of preeclampsia, which is pregnancy-induced hypertension with protein in the urine, or eclampsia, when seizures occur. Both of these conditions are extremely dangerous, as they can cause stroke, placental abruption, and restricted growth of the baby. That's why, if a pregnant woman experiences a sudden severe headache, vision problems, or fits, she should be taken to a healthcare facility immediately. Another danger sign during pregnancy is the presence of fever and chills. These usually suggest an underlying infection. Possible causes include chorioamnionitis, which is infection of the membranes surrounding the baby, pyelonephritis, a kidney infection that is more common in pregnancy, or septicemia, a severe infection that spreads through the bloodstream. All of these conditions can be dangerous for both mother and fetus. That's why any fever with chills during pregnancy should be treated as an emergency and evaluated by a healthcare provider immediately. Leakage of fluid per vaginum during pregnancy is another important danger sign. This usually indicates premature rupture of membranes, also called PROM. If it happens before labor begins, it increases the risk of infection, such as chorioamnionitis. If it occurs before 37 weeks of pregnancy, it is known as preterm prom or PPROM, which can lead to preterm birth. Therefore, any unexplained leakage of fluid should be reported to a healthcare provider immediately. One of the most important warning signs in pregnancy is reduced or absent fetal movements. This may indicate fetal distress due to problems such as intrauterine hypoxia, growth restriction, or even intrauterine fetal death. That's why a sudden decrease in the baby's movement should never be ignored. It needs urgent assessment with fetal heart monitoring and ultrasound to ensure the baby's well-being. Another key danger sign is the presence of labor pains before 37 completed weeks of pregnancy. This usually suggests preterm labor, which can result in a preterm birth. Babies born too early are at higher risk of complications, such as respiratory distress syndrome, feeding difficulties, and even an increased risk of mortality. That's why preterm labor pains should always be treated as an emergency, requiring immediate medical care. The last important danger sign is prolonged pregnancy, which means the pregnancy continues beyond 42 weeks. After this time, risks to the baby begin to increase. These include fetal distress due to reduced placental function, meconium aspiration syndrome if the baby passes stool into the amniotic fluid, and a higher chance of stillbirth. That's why prolonged pregnancy requires careful monitoring, and in many cases, doctors may recommend induction of labor to ensure the safety of both mother and baby. That brings us to the end of today's session on danger signs of pregnancy. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.